I'm Dr. David Don Wartinger, and I've been asked to prepare this video presentation outlining recent research on the relationship between roller coasters and renal calculi. For the past decade, urologists at Michigan State University have studied roller coaster riding as a mechanism to facilitate the passage of renal calculi. Over 300,000 Americans seek emergency room care each year for renal calculi, and 1 in 10 Americans have had a renal calculi. If you've ever ridden a roller coaster in the past, you may have already received a therapeutic benefit without even knowing it. Almost a decade ago, patients at Michigan State University Urology reported passing renal calculi in association with riding amusement theme park thrill rides. One patient reported passing a renal calculus after each of 3 consecutive rides on the research-identified roller coaster. Eventually, a moderate intensity roller coaster was identified as the predominant facilitator of renal calculi passage. An original peer-reviewed article has validated our pilocalyceal renal model as an excellent patient surrogate to study facilitated renal calculi passage using roller coasters. Our pilocalyceal renal model was developed specifically for this research project. CT urogram 3-dimensional information from a renal calculus forming patient was obtained. This information was placed into a 3D printer and a cast of the pilocalyceal system was created. This pilocalyceal renal cast was embedded in silicone and ultimately removed. The silicone was resealed, filled with urine, and multiple renal calculi were placed into the model. 4 renal calculi volume groups were studied: less than 5 millimeters cubed, 8 to 27 millimeters cubed, 55 to 75 millimeters cubed, and 120 to 140 millimeters cubed. Renal calculi were placed into either the upper, middle, or lower pole calyceal system. Prior to each ride, the renal calculus position in the calyceal system was recorded. Following the ride, any change in calculus location was documented. A renal calculus was considered passed if it moved from its starting calyceal location into the renal model trap below the level of the UPJ. The control ride for this research project was the Walt Disney World Railroad. If you're interested in learning more about this particular ride, go to YouTube videos and you can obtain a point of view perspective from the ride. Our research facilitated roller coaster was the Big Thunder Mountain Railroad roller coaster. A point of view perspective of this ride can also be obtained on YouTube videos. Make sure that you look at a video obtained prior to 2010, which is the time our research data was collected. This ride has been remodeled in recent years. No renal calculus ever passed regardless of size or starting location while riding on the Walt Disney World Railroad. The results we obtained from the Big Thunder Mountain Railroad roller coaster were dramatically different, however. During this study, we evaluated 174 renal calculi rides. When the renal model was located in front seating on the roller coaster, renal calculi passed 40 out of 120 times for a renal calculi passage rate of 33.3%. When the pilocalyceal renal model was located in the rear car of the roller coaster, stones passed 37 out of 54 rides for a renal calculus passage rate of 68.5%. Renal calculi were twice as likely to pass with the model located in the rear car of the roller coaster. Renal calculi from all 4 renal calculi volume groups passed with roller coaster facilitation. Renal calculi from all 4 renal calculi volume groups passed out of each calyx with roller coaster facilitation. An ideal roller coaster to facilitate renal calculi passage subjects riders to quick drops and sharp turns, but it does not exceed 40 miles per hour or invert riders. Riding a roller coaster benefits renal calculi forming patients only if the renal calculi can pass through the uretrovesical junction without obstruction or undue distress. Periodic roller coaster riding may dislodge renal calculi before they reach obstructive size, greater than 5 millimeters, thus reducing painful renal colic and perhaps surgery. Post-extracorporeal shockwave lithotripsy roller coaster riding may facilitate passage of fragments that could enlarge and cause renal colic and require further surgery. An obstructive sized renal calculi, greater than 6 millimeters, might be dislodged from a pilocalyceal renal location when subjected to the kinds of forces observed in this study. Roller coaster riding may offer patients an entertaining as well as preventative and therapeutic option to medication, dietary restriction, and further surgery. Acknowledgement. The authors acknowledge and appreciate the corporate courage, assistance, and consent of the Walt Disney World Resort and its many cast members in the performance of this basic science research to improve healthcare.